plus people we have participating. No, I think it's about 12, but that's great. All of you who are here, we appreciate you. And we think this is going to be a wonderful topic, particularly given kind of where we are with COVID. And I'm going to introduce our speaker in just a moment. Stu, I assume you'll provide some announcements from the chamber perspective when we're finished. So please invite you all to hang on after that. We are going to have a few minutes, probably 5 or 10 minutes for questions and answers for Mino. So what I'd invite you to do is just, if you have any questions during our presentation today, just please put them in the chat, and then we'll have Mino get to all of those questions once we're finished. So now I have the opportunity to introduce to you our wonderful speaker and presenter for today. Mino Sastry is the Vice President of Service Lines and Market Development at Stanford HealthCare and ValleyCare. Currently, Mino has responsibility for leading the development and execution of business development efforts, including growing key clinical services within the region. Mino is recognized as a leader in professional development, operational systems, employee and customer engagement, cost and vendor management. Mino resides in San Ramon with his wife, Allie, and his 3 children. During his free time, he volunteers as a youth coach in basketball, soccer, and Little League. And despite the fact that he is a rabid 49er fan, we're going to let him go ahead and present today. Anyway, you see my little Stabler jersey back there. Go Raiders, 3-0, by the way. So as a valued member of the Chamber of Commerce and here to talk with us today about some of the latest updates of the Delta variant, the vaccine progress in our community, and provide us with updates in Stanford HealthCare ValleyCare system, please welcome our presenter today, Mino Sastry. Mino, take it away.
Thank you so much, Terry, for the wonderful and always humorous introduction. Appreciate it. Thank you to Stu, Kathy, Maria, and all of the San Ramon Chamber for allowing me the time this morning to share you just a few updates of what's going on in our hospital as well as in our community, and also try to highlight a few programs and new developments over the past year. So let me go ahead and share my screen here. And I'm gonna in presentation mode. And are we good there with the screen? Thumbs up? Yes, perfect. Well, thanks again. As Terry mentioned, and Stu, I want to thank everybody for giving me a time just to share of what's going on. Obviously, top of mind continues to be, unfortunately, the pandemic and the latest trends in COVID, the Delta variant, and latest status around vaccination. So I'll share a little bit of update of what's going on in our hospital as it relates to that, as well as some trends in the community. I also want to take some time to really share with you in the Tri-Valley community just a few cherry-picked highlights of a few programs and latest developments around those programs, and really the progress we're making in bringing more complex services to this community in an effort to really keep patient care for those most critical patients right here closer to home rather than traveling outside. We'll also talk about a few investments we're making in the world of technology and robotics. Also, that's going to relate to better and more quality patient care. And then lastly, we'll end with a few highlights around what's going on in terms of constructions and renovations in our hospital that's also going to benefit the breadth and depth of services we're providing to the Tri-Valley. So appreciate the time once again, and let's go ahead and get started. So first and foremost, the Delta variant and the recent surge we've had as of last August. So as you guys know, we encountered a kind of second, third wave of the COVID spike, and we certainly experienced it in our hospitals back in August. And that was a result of the spread of the Delta variant. And that made up about 90% of all of our cases at that time. What I'm happy to report, and the reason I underlined it, is we've seen a dramatic decline in those rates, certainly in our hospitals, certainly with the Delta variant, and the total number of cases in our hospital. So very, very happy about that new trend, and we'll continue to monitor that for many, many months. There's also been an overall decline in COVID positivity rates and cases within our communities. Obviously, the state of California, but Alameda and Contra Costa County to name those closest in our Tri-Valley area. We also saw COVID rates drop within our staff, which was a problem at one point. So we've seen those dramatically decline, making our entire hospital environment a safer place to be. Now, in terms of those folks that are still coming in with COVID, the Delta variant is still the top and main variant detected in all of our Stanford lab results. The good news is we haven't seen any new additional variants from any of our cases that continue to come in within our Stanford hospital locations. Now, I will personally attribute some of the success or the declination in rates of COVID to the state public health order that was issued by Governor Gavin Newsom back on August 5th, when he announced all healthcare workers to be required to be fully vaccinated by actually today, September 30th. So today's kind of a milestone date in the healthcare industry, at least here in California, unless they have a medical or religious accommodation. So as a result, Stanford HealthCare and Stanford HealthCare ValleyCare required all of their staff to become fully vaccinated by today, by September 30th, unless they were approved for a medical and religious accommodation. So during that process, as we were encouraging our staff and requiring our healthcare staff and all of our contractors working in our hospitals to get fully vaccinated, we also implemented as a heightened measure a very strict masking and testing protocol. So while folks were still getting on their path to vaccination, we were requiring them to take a COVID test twice a week. We were also asking them to mask in very critical areas as well as outside if you were unvaccinated. Now, these are all recommendations that were followed by the CDC guidelines, as well as our own internal infection control policies and guidelines. We will continue to monitor the situation. We'll continue to follow CDC guidelines and our own infection control recommendations and make any necessary changes in our hospital environment. I would say, since today is September 30th, that we are extremely pleased at Stanford HealthCare ValleyCare of the vaccination rates of our staff completed today, close to 100%, also dealing with some of the accommodations. And we've actually encouraged many who were on the fence or not willing to shift over and become vaccinated. So all signs pointing in a positive directions, at least for our hospital, but also around our neighboring communities. So we hope to have a good fall and winter season. We know flu season's upon us. So we'll continue to monitor it effectively, closely. As I said, make changes as we need to. But I think with the vaccination rates going up, it is a good sign of at least declining rates in not only in our hospital, but as I mentioned, around the communities in Alameda County and Contra Costa. I would be remiss as a healthcare executive and an employee if I did not share the clinical imperatives of vaccinations. We at Stanford HealthCare ValleyCare truly believe vaccination is the most effective strategy for preventing illness and death and curbing this entire pandemic. The vaccines significantly reduce the risk of developing infection and decrease the chance of spreading the virus to others. We all know that if you're fully vaccinated, you can still develop the infection, but the risk of you developing a severe disease or death is dramatically reduced. And those are the facts. The vast majority of cases of COVID-19 among fully vaccinated people are asymptomatic or mild. Another fact that I need to highlight and share with the community is 99.6% of patients in California that are currently hospitalized with COVID-19 related illness since the vaccination process began have been unvaccinated. 99.5% of patients in California who have died from the COVID-19 since vaccination began have been also unvaccinated. Once again, these are facts that we can't ignore. Also, minimizing the risk of transmission is especially important given the contagious Delta variant that we saw in the summer month of August. So once again, as a healthcare provider, it's especially imperative that we do all we can to prevent avoidable harm and stop the transmission of this virus. We work in a hospital. We understand that the patient population that comes in are immunocompromised. We want to protect them because they're already unstable. We want to protect their families once they do get home. we want to protect our staff so they can safely continue to provide the critical patient care. And so for those reasons, we are strongly encouraging our staff as well as the community to think about vaccination. I also wanted to share some facts around the vaccines. I know that's also been a topic of conversation, debate. We do know recently that the FDA formally approved the Pfizer vaccine for ages 16 and over. We also know that they're still highly recommending and is under emergency use authorization for the Pfizer vaccine for ages 12 and above. So that's still highly recommended by the FDA. We also know Moderna, while under emergency use authorization, has submitted a formal application for FDA approval for ages 18 and over, and that's still pending, but expected to be approved later this month, or in the month of October, I'm sorry. And then we also know J&J is expecting to apply for the same formal FDA approval by the end of this calendar year. So they're all on the path from moving away from emergency use authorization into formal FDA approval for those folks that still may be concerned about that designation. Now, I do want to share some other information around emergency use authorization. This only allows the FDA to help protect the public against threats such as the COVID-19 pandemic, and they make these products available. By no way are we cutting corners, or is the FDA cutting corners by designated emergency use authorization. It truly is cutting out the red tape a little bit to get it out into the public. There's no indication that these vaccines are only experimental in nature or less safe. In fact, the safety and efficacy data available for these particular vaccines are greater than a lot of licensed products that are currently out in the market. They went through very rigorous vaccine trials that were typical of standard large-scale vaccine trials and went through all the proper steps, even while they were approved for EUA. And we also know that the data will continue to be, and the trials of these vaccines will continue to be analyzed extensively so we can further curb this pandemic and hopefully eliminate it altogether in the future. The latest development is around the boosters. So I also wanted to share just this past week that the CDC has provided guidance on administration of booster doses to those certain population groups. We at Stanford HealthCare are also scheduling, based on these latest developments, are scheduling appointments for those established patients who received their second dose of Pfizer vaccine at least 6 months ago. The other criteria is if you're over age of 65, you're a resident of a long-term care facility, if you're ages 18 through 64 but have an underlying medical condition, you'll qualify for the booster. If you're at any risk of transmission of exposure to your occupational or institutional setting, third vaccine dose for immunocompromised individuals. We also have a list of locations. I'll leave this up on the screen for a minute here for those that do qualify in any of these categories and are interested in that third booster. That third booster has shown to be effective to fully extend the period of vaccination against the COVID-19 pandemic. If you're unclear whether you qualify or not, and if you are interested in the booster, we do recommend that you talk to your provider who can provide you with more details, and you can certainly call into any of these locations, and they're happy to help you as well. And then lastly, just wanted to also share that Stanford HealthCare ValleyCare continues to provide the community all across the East Bay an opportunity to get COVID tested or vaccine if you do choose to. We do have locations available in Livermore and Dublin. For the Livermore site, we're open Monday, Thursday, and Saturdays between 11 and 7 p.m. for vaccinations, and we do vaccinations for ages 12 and older. And in our Dublin site, we're available Tuesdays, Thursdays, and Saturdays between 11 and 7 p.m., once again for vaccines 12 years and older. And then if you need to have a COVID test at any point, we're also available in our Livermore location, Monday through Friday, 8 a.m. to 2 p.m. And then Saturday, 8 a.m. to 12 p.m. So please, once again, encourage you to stay safe, stay healthy. If you choose to get vaccinated, if you're currently unvaccinated, we offer that opportunity to you all. And then if you need to get COVID tested, we also offer those opportunities to the community. So I hope that was somewhat informative, but we certainly wanted to share a little bit about what's going on in our hospital and what we're noticing in the communities around us, around COVID, the variant, as well as vaccinations. I now kind of want to shift a little bit to some exciting programmatic updates. These are, even in the midst of the pandemic, very happy to report some milestone achievements, some growth of our programs, and very successful patient stories related to some of these programs over the past year. And so I really wanted to shift to highlighting some of the great work we're doing here at Stanford HealthCare ValleyCare, and that is really benefiting and contributing to benefit to the residents of the Tri-Valley and beyond. So first, I wanted to highlight some successes in our cardiothoracic program, part of our cardiovascular health service line. Back in June of 2020, we made a decision to have Stanford faculty, our Stanford faculty experts, take over our heart program. And this was led by bringing on very expert surgeons in the likes of Dr. Maria Elizabeth Curry, who's very accomplished, trained in the field of cardiothoracic surgery, as well as Dr. James Longoria. James Longoria is really the leader of the program and really has a vision for where he wants to take our cardiothoracic program. He actually is patented and is nationally known for his patented procedure, the TT Maze, to deal with atrial fibrillation. In fact, just last week, we had 2 Harvard physicians from Brigham Young University Hospital come and observe his procedure live so they can learn and bring that program into their facilities in the East Coast. So very excited for a hospital like Stanford HealthCare ValleyCare to have that type of recognition, success around our heart program, and a leader in the likes of Dr. Jim Longoria to really build the vision. Since their time here, in June of 2020, we did our first heart surgery under their leadership. And over that course of that year, we did a number of firsts. And the reason this is exciting is these are complex, critical heart procedures that were previously never done at Stanford HealthCare ValleyCare. And so, once again, this highlights the opportunity for us to provide more critical and complex services to all of you, to your family members and loved ones and friends that might require those critical services, and not having to travel a little bit further distance for those types of services. And in fact, in April, this past 2021, we also celebrated our 100th milestone heart surgery, major heart surgery. We're now up to about 150, 160, don't quote me on the number, but since April, we've continued to dramatically provide these services to those patients that are in most need. The success of the heart program has actually generated a lot more recognition and availability to patients outside of our existing Tri-Valley community. We've now extended services and have seen patients and providers sending their patients to us from the Central Valley, as far down south and the Central Coast and Southern California. We've also gone up north to Oregon, where we've seen patients from Oregon, and as far east as Virginia. So once again, a very proud recognition that we have at Stanford HealthCare ValleyCare for our heart program, that we've been able to partner with the existing services out here in the Tri-Valley, in the Central Valley, and offer that another layer of critical services to those that need it most. So very happy about the success of cardiothoracic care at ValleyCare. My next update, also very exciting, and really kind of the growth of the program and the advancement of clinical services we're able to provide, is in our orthopedic and spine service line. So similarly, a couple years ago, we decided to grow our orthopedic and spine programs with our Stanford team. And in particular, spine, we brought over 2 new spine surgeons into the community. This is Dr. John Kleinmeyer and Dr. Michael Seng. One great story that I wanted to highlight, and you can see her picture here on the screen, is a patient who was very excited to share this story with all of us. is a teacher out of Modesto, Andrea Hogue, who has been suffering from spinal problems for many, many years. She actually had a spine surgery a couple of years ago with Stanford. But unfortunately, what happens in about 20% of all spine patients, they struggle with what we call reherniated spinal discs, a common condition that happens, like I said, in about 20% of spinal patients. She was suffering dramatically, couldn't walk, feet were numbing, she couldn't sit, she couldn't stand, she couldn't take her dogs for walks, which is what was the love of her life. So many things. None of the pain meds were working, none of the physical therapy was working. So what happened is Dr. John Kleinmeyer, who was trained recently in a new tiny apparatus called the Barricade Annular Closure Device, or simply Barricade, decided to do a surgery installing this Barricade device, which really eliminates and prevents any further reherniated discs. Dr. John Kleinmeyer was actually the first surgeon in the state of California to do this. So once again, we were very proud and happy to share the story, to have such an accomplished surgeon investigate, diagnose the treatment needs of this patient, Andrea Hogue, to do a procedure that was never done here in the state of California, and to do it locally in our community in Stanford HealthCare ValleyCare. Very excited, and most importantly, to be able to report as of this past year, calendar year, Andrea is doing great. If you've read the story, walking her dog daily, free of pain, and extremely grateful for the work of Dr. Kleinmeyer and the entire Stanford team here at ValleyCare for her surgery, her recovery, and now her well-being. So very, very happy to report that. And once again, just another advancement of our spinal program here in the Tri-Valley and beyond. Another recognition and highlight I wanted to share is a very critical program to the community is our stroke program. It was because of folks like you, in fact, the Tri-Valley constituents themselves, the local officials, about 2.5 years ago that encouraged Stanford HealthCare ValleyCare to open up a stroke center. It was so needed that we've had some private donors also participate in helping funding that stroke program. I'm really happy to report that since that time, and in this past year, if you look to the top right there, we were ranked #1 out of 391 hospitals for our stroke mortality index. That means 0 deaths. For those patients that have walked into our emergency room and been treated for a stroke, we were able to accomplish that feat without a single death, and very proud of that. In addition, this past year, we also achieved from the American Heart Association the highest quality award, which is the Stroke Gold Plus Quality Achievement Award, which is part of the Get With Guidelines requirements. And basically what that means is we were able to meet very critical and high-level standards of care for 2 consecutive years. We also have to meet a very high compliance level to a number of critical heart failure and stroke metrics to get this type of designation. So we were previously silver. To get the gold this past year, once again, is a very, it's an attribution to our multidisciplinary care. It's not one group or one individual. It's the neurologists, it's the hospitalists, it's our ICU care, it's our vascular surgeons that all participate in the stroke program and that multidisciplinary approach to really enable these high quality outcomes for our patients. We also believe in evidence-based workflows and implemented many of those in our hospital. And of course, our affiliation with Stanford Medicine and Stanford HealthCare gives us immediate access to neurointerventional radiology or neurosurgery in the case of those severe emergencies, where we're able to have a seamless continuity of care and a transfer to those facilities for those critical care patients. So once again, very excited. This is something really grassroots that was started by the constituents of the Tri-Valley, asking Stanford HealthCare to become a stroke program. And I hope we've been able to deliver on that promise. And some of these recognitions, I think, are proven that we have. And so very happy and proud to be announcing that. Part of also our value that we want to continue to give to our community, we just launched this past month a stroke support group. This is also something that came up very loudly from our community, that we needed to do more outside of the hospital for our stroke patients. We talked to our donors. We talked to very key constituents in the community who wanted a stroke support group. So we were proud that we were able to launch our first one on September 15th. We're now going to follow that up with a monthly stroke support session, the third Wednesday of every month. Please, if you know any friends or family that have suffered from a stroke, unfortunately, and they are looking for something, this is open to all of our community. It's free of charge to just come and participate and be with other stroke patients and talk about your experience. The topics in those sessions are really driven by the actual patients themselves. We, of course, have expert facilitators that will also come up with some topics, but really it's dealing with the psychological therapy of these individuals and listening to their concerns and how they're navigating through life after such a horrible situation. We've also heard from them. It gives them the opportunity, who many of them are in the care of caregivers, whether professional caregivers or family members that are providing those care. It gives them the opportunity to separate themselves for at least a moment away from those caregivers and share their stories and their experiences and their concerns or their accomplishments with other like patients. We are also considering and looking into an opportunity to actually do a support group for those caregivers. As anybody knows, the patient themselves are obviously suffering and going through a lot, but the caregivers, typically family members of those individuals, also go through a lot. And so we do recognize that and want to provide some sort of outlet for them as well. And so we're looking into launching that as well. As I mentioned, these support groups are facilitated and led by ValleyCare healthcare professionals. They can be neurologists some months, they can be physical therapists or exercise physiologists, and then, of course, certified psychologists that are trained and are experts in these types of settings. I did put in a little pitch. We are welcoming community psychologists as well that want to volunteer and participate. We could certainly use more help. And so if this is something that is of interest to you and you want to provide some support to these needed patients in our community right here in the Tri-Valley in Pleasanton and other locations, please reach out to me. I'll be happy to set you up and get you signed up for one of our future sessions. Because unfortunately we're still kind of in this pandemic phase, we're starting these virtual, but certainly hope to do a hybrid in-person and virtual model very quickly here. So we'll continue to monitor the trends in our communities with COVID and hopefully get back to a place of normalcy at some point in the future. Next, I want to talk about, as we all might know, a very difficult topic of cancer, but in particular lung cancer. So lung cancer, anybody who follows cancer statistics knows that lung cancer is the leading cause of all cancer-related deaths. It actually kills more people each year than breast cancer, prostate cancer, or colon cancer combined. So a very serious disease, something we hope to screen and identify early, so we don't fall into that category. But it is 22.4% of all cancer deaths are related to lung. So it's a very serious situation and number one priority for Stanford HealthCare and ValleyCare. Now, there's usually three primary ways that lung cancer patients can enter into a health system and begin some form of treatment. They're either seeking treatment because they have symptoms and they've been feeling a certain way and they come in and get treated. Typically, unfortunately, this is when that disease has spread and it's in a very severe state. And so there weren't a lot of preliminary signs or treatment or identification of those patients. Second, and I'm highlighting numbers 2 and 3 because we'll talk a little bit more about it, is findings that are discovered when you enter into a lung cancer screening exam. So you were part of a lung cancer screening program, you went in, you've done your test, we're able to identify something and start to treat you. The third is when there is a lung nodule, what we call an incidental lung nodule identified for a patient that comes into our hospital for a completely different condition. Could be a shoulder injury, it could be anything else, and you're getting some scans. And then in that scan, we're able to identify an incidental lung nodule. So those are the different ways that we can identify potentially a lung cancer patient. In terms of lung cancer screening, another highlight, in July of 2020, Stanford HealthCare ValleyCare, by the American College of Radiology, was designated a hospital lung cancer screening center because of our safe and effective imaging of detection of lung cancer. So that's, once again, a wonderful designation. We are able to administer a lung cancer screening program. We've been designated by the American College of Radiology to do this, and we're excited to offer those services once again to this community. It does provide the best screening options for our patients, as well as support the continuum of care with our multidisciplinary cancer team. On the screen here, you have our location for those that are interested in calling and understanding if you're eligible to enter into our lung cancer screening program. In terms of eligibility, we do follow the criteria set forth by the U.S. Preventative Services Task Force, as well as the National Comprehensive Cancer Network. So some of the eligibility criteria is those aged 55 or through 80, people who have are currently smoking or have quit within the last 15 years. We also accept those over 50 years and have 20-pack year smoking history, and one additional risk factor: radon exposure, occupational exposures, cancer history in your family, or any type of disease history related to COPD or pulmonary fibrosis. So once again, contact your provider, call our helpline right here if you do feel like you or any members of your family or friends might be interested in entering a lung cancer screening program. But my objective here is to focus on that number 3. We talked about the incident nodules. So the reason that's so critical and important is, one, patients come into the hospital for a number of different reasons, a number of different factors. They're not going in for a lung image, a lung cancer image. They may be going in for somewhere else. But in those patients, sometimes these incidental lung nodules might be identified. Unfortunately, if you don't have certain investments or technology, which I'll talk about in just a minute, it's very difficult to identify because you're not looking for those incidental lung nodules. What's also been shared as a fact is in those patients that have incidental lung nodules, 25% of those actually turn out to be malignant. So 1 out of 4. Whereas compared to an individual actually going into a lung cancer screening program and also identifying these lung nodules, only 2% of those actually turn out to be malignant. So you can understand the need to figure out a way to identify those patients that have come in for something else, but you have a lung nodule identified. And unfortunately, in today's current environment, 70% of those patients go untreated or unidentified. So what I'm happy to report is that Stanford HealthCare ValleyCare, right here in this next month in October, we are implementing a new Medtronic lung GPS cancer orchestrator. That is certainly a mouthful. We're still learning about the full benefits of the technology. But in a nutshell, we'll be working with our vendor in this next month to implement this advanced technology that will be attached to all of our systems and will basically use artificial intelligence and algorithms to extract all of patients where that data and results from any other condition they've come into the hospital for. If that shows they've had a lung nodule, we'll be able to bring those patients to the top of the list. And all that means is, we talked about the 70%, right, on average, that patients that have these lung nodules, but unfortunately these facilities and these providers We'll never know. We're now able to bring those types of patients to the top of the list. We can send alerts out to our care team who can quickly identify, connect with this patient, and start to engage in whatever treatment might be required. And potentially, if unfortunately those lung nodules turn out to be malignant, we've caught it so early in the phase that we're able to treat it effectively and safely and hopefully with a positive outcome. So that's really the idea behind this new innovative technology, is bringing those previously unidentified lung nodule patients, incidental lung nodule patients, to the top of the pile, sending out alerts to our care team that can immediately start care and coordinate care with those individuals that previously would have been unidentified and lost in the pack. So really excited about this new innovation, excited about bringing it to the patients here in this community, and just another way for us to fight the battle of cancer, and certainly lung cancer, which is the #1 cause of cancer-related deaths. I'm now going to shift to just a couple other new implementations we did this past year. One is around our 3T MRI. Now, we certainly are not the first to have this. This has been around for some time, but we're excited to help the Stanford HealthCare ValleyCare to finally implement it this past year in 2021. What this does is it gives us a capability, much higher level and deeper capabilities to support diagnosis of a number of complex service lines like neurology, oncology, orthopedics, and pediatrics. It gives us a higher level of images and reads. We can also, with our partnerships with Stanford Medicine and the manufacturers, we put a lot of clinical and quality protocols behind every image result. So depending on what the result shares with you, there's a very clear pathway of what you need to do next to treat that patient based on that image and that diagnosis from the image. So a number of great quality efforts around this new piece of technology that's right here in our hospital for those patients that are coming in for a number of different conditions and issues, and getting a scan on this piece of equipment. We're able to do so much more that previously we weren't able to do. We're also able to localize that care and do all of that right here in our hospital. Once again, for the theme to be, we want to keep these patients in the Tri-Valley, right here in the Tri-Valley, for almost all of the services they'll need at Stanford HealthCare ValleyCare. So that continues to be our mission, and the 3T MRI takes us another step in that direction. The next implementation we did this past year is the Da Vinci robot. Also, once again, a common robot. A number of facilities have them. We certainly are not the only facility to have the Da Vinci robot, but we're excited to bring it finally to Stanford HealthCare ValleyCare. What this, our general surgeons, urologists, gynecologists, colorectal surgeons, cancer surgeons, number of surgeons are able to now use this. And basically what it does is it's going to cut your surgery time in half. It's going to cut your recovery time dramatically. And because we're able to use this robot to do a much smaller invasive incision into your body, and in addition, it provides depth perception with a video camera that's going to allow the surgeon to really pinpoint with accuracy their targeted location. So basically not cutting a larger hole and a larger invasive procedure into the body. We're able to minimize that. We're also able to minimize the time of an actual surgery from previous periods. Your recovery, because the hole and the incisions into your body are much smaller, and it makes the entire procedure efficient. The quality outcomes are going to be much better, and your recovery and your patient satisfaction is going to be much better. So very excited. I know our surgeons were pleased once we were able to bring this into our facility, and it just adds another layer of their capabilities and more surgeries that they can do with the help of this wonderful robot. I'm coming up near the end here. So I just want to end with a lot of other great improvements and investments we're making in our existing hospital to continue to add the breadth and the depth of services we want to bring to the Tri-Valley and beyond. Part of a lot is to build more space so we can recruit more specialists that offer a deeper set of skill sets to certain level of patients. And partly doing that, we have to create the space. So we're expanding our cardiovascular health clinic. So that should be live and open, I believe, in May of next year. That's right here on campus, right next to our hospital in one of our medical office buildings. So you'll see that on the first floor, and we'll certainly have a ribbon-cutting ceremony at the appropriate time. We're also expanding and doing a number of construction and renovations to expand services in the areas of urology, gastroenterology, general surgery, pulmonary, and neurology, as well as a women's health center. So these are all things that are being planned and designed out over the next several years. Once again, right on our campus next to the main hospital in Pleasanton. So we expect those to all continue to happen over the next couple of years. Once again, growing the number of providers and services we're able to provide, and then also advancing the types of procedures and the types of patients we can actually see within those clinics. We're also making some very needed and dramatic improvements in our pharmacy capabilities here at the hospital. Most importantly, being able to compound our own drugs right here in the hospital versus outsourcing that. That provides timely and more efficient real-time drugs to our patients and critical drugs immediately while they're here in the hospital without creating a wait or a lag time there. So that's something that's going live here soon. We're also upgrading our entire interventional radiology platform. Some of the highlights of that project is we currently have 2 cath labs that are pretty outdated and old in terms of the equipment and the capabilities. We're upgrading not only both of those cath labs, we're actually building a 3rd cath lab. So now we'll, over the next couple of years, we'll have 3 optimized cath labs to do more advanced heart and vascular procedures. In addition, we're upgrading all of our medical imaging equipment, CT, X-ray, MRIs, all to where it needs to be in the 21st century. And so this by far is our most expensive investment and also our longest and most complex project that we're working on that will take us into 2024. So a lot of great improvements happening at the hospital. For those of you that do receive your care at Stanford HealthCare, ValleyCare, you've probably noticed a lot of the construction already. That will continue for the next several years, but all as a way to provide more in-depth and well-needed services to this community. And then lastly, we have a building right down the road from the hospital, what we call 5725. We're expanding our orthopedic clinic presence there. So that is going to be happening all across the 2nd floor, continue to add more clinic exam rooms, more patients, more throughput for orthopedic medicine, as well as on the 1st floor, we're completely expanding our entire cancer center. So we'll be able to go from 12 infusion rooms to about 25 infusion rooms. And then as well as our radiation oncology and clinical exam space will all get expanded. So we'll be able to, that allows us to bring more cancer providers, more subspecialties, prostate, colorectal, breast, continue to build out our cancer portfolio and provide a lot of those services directly at that clinic and in that infusion treatment area. So I'm going to end with my final slide, and this is a plug for Stanford HealthCare, ValleyCare. We are celebrating our 68 years anniversary since our existence, since 1961. This celebration is going to occur on Saturday, October 23rd, between 10 a.m. and 2 p.m. I'm certainly disheartened and disappointed that we couldn't have a in-person street fair like we had initially planned, but we've got the next best thing is going to be a virtual street fair. We have a group that's assisting us with the entire event who's done this with healthcare organizations in the past, and we're really excited, and we think the experience is going to be great. I really hope you guys, some of you in the attendance today, would be willing to register and attend. You'll get to hear great highlights from our doctors, things we're doing, a lot of great events, educational topics like breast cancer and sports medicine, and just a number of great things. You can also view that celebration well after the event because we'll have that site up and running for many, many months. So really excited about that day. You'll see my face if you do attend, and really excited to celebrate 60 years of what ValleyCare has meant to this community and where it's going and how we're advancing it. So I want to thank again everybody for attending today, the San Ramon Chamber for giving me the opportunity, to Terry and Stu for your gracious words. And now I'll be happy to answer any questions. So thank you.
Wonderful. Thank you, Mino. Appreciate your time and so appreciate and congratulate Stanford HealthCare, ValleyCare for these amazing new programs and advancements, particularly your gastroenterology. I'm personally excited about that, I'm just saying, and for your contribution to the community. So thank you so much. Again, October 23rd is that event, right? So please feel free to go on and register for that. I understand they're also going to have virtual hot dogs, popcorn, and soda pop. So great. Everyone register, please. I apologize for the shine on my head. It's the sun coming through my office window. It's not a patch of gray. Stuart, trust me, Just for Men takes care of that. By the way, I did get my Pfizer booster yesterday, Mino. I went to Safeway. They sent an email. I said, I'm there. I fell into the occupational setting category. So I was able to go to Safeway, get a quick booster, free, and I was able to get a gallon of milk and a loaf of bread at the same time. It was awesome. It was awesome. All right, and I felt fine. I little soreness in my arm, but other than that, it was great. So, all right, we do have a few questions. We'll knock those out, Mino, if you don't mind, and then we'll let everyone get on with their day. Our first question is from the lovely and talented Laura Steinbeck. She says, Mino, I've got this ugly rash on... No, that's not topical, Laura, but I'm sure the Da Vinci robot can help with that, I'm sure, right? All right, let's move on to a topical question. We're hearing that the vaccine may become available for children under 12 years old as early as late October. Are you hearing the same thing? And do you have recommendations for parents as the vaccine does come online for younger children?
Yes, we're hearing the same thing. I did hear also the end of October. And so they are looking for, once again, approval and recommendations to provide vaccines for ages 2 through 11. So once again, there's a recommendation already for 12 and over, but 2 through 11, we're hearing the same things. We're monitoring that situation. Once we get the guidelines that is being recommended and safe, we will obviously be willing to offer those up. As a parent, I have 3 children. They're actually, 2 of them are going to be turning 12, November 30th. I'll be very honest and transparent. My wife was hesitant because of their age to consider it. I also have a 10-year-old daughter. I am certainly going to have my kids who turn 12 get vaccinated. And then obviously I'll continue to monitor the ages 2 through 11, or I'll simply wait for my daughter to turn 12. And I do plan to have them vaccinated as well.
Great, thank you. Next question. Some are beginning to get the Pfizer booster. Will the booster be needed for those who received Moderna or the J&J vaccine?
That is still being determined. So I don't have all the data behind that yet. Thank you.
Okay, next question. Do you foresee a statewide vaccine mandate coming?
Great question. We've got healthcare workers. I actually, complete guess, there's no expertise behind this comment, but I'm going to give my honest opinion. Because of the mandate and the public health order for healthcare workers, we've actually seen, and anybody who's followed the news and businesses, many private businesses are actually implementing that themselves. And I think that's kind of where we want to go is I think we're seeing those folks that are either having critical staffing shortages because people are out with the COVID virus, or safety of customers wanting to come into their business, whatever it may be. Those are, or their personal, faith in the vaccine. They're actually requiring their employees to do it. There's certain still business rules around indoor businesses and things like that that are making it difficult, that people are feeling like we just need to move in this direction. So there's a lot of different factors. I personally don't think the state of California will mandate it. But once again, this is just a personal opinion. I don't really have any expertise behind that.
Okay, great. Well, thank you for that. I appreciate it. Next question comes from Michael. I believe this is Michael Roberts from your Rotary Club of San Ramon. For more information about the Rotary Club of San Ramon, by the way, go to sanramonrotary.org. Point of clarification, if we are employees who work with individuals who have compromised systems, when can employees 65 and under get the booster?
You know, that's a great question. Unfortunately, I don't have that answer for you. I will honestly say, I believe the direction is they're going to start to open the booster to more and more populations over time. I do think I would encourage you to talk to your provider, explain that situation to them, because and actually I'm going to make a note of that myself and bring that up here. But that's a very, very good point in terms of your close relationship with individuals that are compromised.
Great. Next question. Some communities are relaxing their mask mandates because of declining COVID numbers. What advice would you have for our community, which has very high vaccination rates?
Yeah, you know, I want to be fair when I say this. I personally, I'm vaccinated. I know the majority of the folks that I'm with are vaccinated. When we're outdoors, I've attended sporting events. I've attended things without a mask. I do wear my mask when I'm in closed quarters, when I'm definitely in an indoor area and around. I also encourage my kids to wear their masks because they're not vaccinated in certain settings. You know, I can't say either way. I do think there's certain outdoor environments that I feel comfortable with it. I also do think our vaccination rates are high in the state of California and in our communities to feel a little bit safer to do that. But unfortunately, with the Delta variant still out there, with folks still unvaccinated, we've just got to be cautious. And so I continue to promote, you know, masking when you can and when you should, hand hygiene, and all of those safety protocols. So I'll continue to share that until we can honestly say we're truly out of the pandemic.
Great. Do you recommend people get the vaccine or vaccine booster and the flu shot at the same time?
Great question. We have not seen any issues with it. I actually just got my flu shot last Friday. I did not get a booster shot. Felt no ill effects from it. So you know, I would say we haven't seen any reactions or any signs of anybody having some negative reaction. If you are concerned, there's nothing wrong with maybe taking a week off and doing the booster or the flu shot first and then the booster. One, I appreciate the question that you're even considering the booster and the flu shot. So we recommend both if you're in those categories.
Great, excellent. Another one from Michael. Your advancements in surgical procedures are fantastic. What about classes and mentoring on lifestyle changes such as diet and exercise?
Wonderful. We do have a diabetes and nutrition clinic actually right as part of ValleyCare services. It's right down the street, 5725. I can certainly put you in contact with there. They do educational classes. They do nutritional recommendations and classes. So we have a whole phone line and registered dietitians and nutritionists that are more than happy to talk to you about that piece of it in terms of diet. We also have our physical therapy department that can also talk to you about exercise. And then once again, we have our whole sports medicine team. So those of you who have children or members in your family that are athletes and out very active, we have a couple sports medicine surgeons who can also do they're actually at the 60th anniversary, we'll be doing a sports educational show, but they can also talk to you about tips and exercise and keeping your body safe and limber as you get older. Excellent.
And thank you to Tracy, who added a nice plug for your physical therapy department as well. So lots of good stuff going on at Stanford HealthCare ValleyCare. So thanks, Mino. Again, we really appreciate your time and your experience and your expertise. Before I turn it over to Stu, I want to just give a plug to Maria Cooper, who is, pulling all the controls, pushing all the buttons for us today from Above and Beyond Productions. And trust me, she does go above and beyond. Some of us go like below and within. But Maria goes above and beyond. So Maria, I don't know, go ahead and type your the URL for your website in the chat. If people want to go to your website, they can check out your services there. So Maria, thanks for all you do for the Chamber and for this community. Mino, one more time, thank you for your presentation. At this point, I'm going to turn it back over to Stu for closing comments.
Great, thank you, Terry. Really appreciate it. Mino, that was absolutely excellent. Thank you so much. Terry, thank you. You always do a spectacular job. And obviously Maria Cooper for helping us out in the background. Just a couple things. As some of you may know, my wife is a 2-time cancer survivor, breast cancer 1 time and melanoma. And all of her treatment was done at Stanford HealthCare. And they have literally saved her life on more than 1 occasion. So we are so fortunate. Originally, before Stanford was part in Pleasanton, we would have to make the 4-hour trip over to Stanford in Palo Alto. And now we can make the 15-minute trip to Pleasanton. And so we're so fortunate to have such a great facility right here within 30 minutes of almost anywhere in the Tri-Valley. So thank you, Mino. Just spectacular presentation. I will say I did call yesterday for my booster shot. I know it's hard to believe that I qualify, but I do. I will, it was about a 1-minute process. I'm all scheduled at the Livermore Stanford facility, their urgent care. And so both Nancy, my wife, and I are scheduled to do that. So on kind of a fun note, we have a bunch of events coming up that I'd like to put a little plug in if I can. On October 21st, we're going to have a mixer, which is actually going to be a Halloween costume contest. So if you have a costume you'd like to participate in, we'll have some great prizes. Dinners at LB Steakhouse and De La Rosa restaurants here in the city center. So that's going to be fun. On November 4th, we're going to have another webinar. This is going to feature Rebecca Bauer-Cahan, our assembly member for our district. So we can learn a little bit more about what's going on from the state of California. And also, I'm sure she'll be mentioning some of the vaccination requirements and things of that nature. So that's on November 4th. And then on December 2nd, one of our highlights of the year will be our community awards dinner. That will be live, if all goes according to plan, at the Bridges Golf Club. And we recognize various people in the community, our Citizen of the Year, Employee of the Year, different things, different people that have contributed to our community and really haven't had the recognition they deserve. So that'll be a great evening at the Bridges Golf Club. Terry Keeney will be our MC for that for maybe the 10th or 11th time that I'm aware of. Terry does a great job. And so we'll have a lot of fun and recognize people in the community that deserve the recognition of our community. So with that said, again, I just want to thank Mino for just a spectacular presentation. Until you've gone through the medical system like my wife and I have, you really don't appreciate all this technology and things that Stanford provides. So thanks again, Mino, great job. And with that said, thank everybody for attending, and we're hopefully we'll have more of these next year. So thank you so much. Any last words?
Thank you, everybody.
Thank you, everybody.